So welcome to the session on alcohol use and violence. It's a pleasure and exciting to have you all here. I'm Dr. Marcia Zibeles Crawford. I'm a professor in the College of Public Health at Temple University. And we have an exciting session for us today. We have three amazing presenters, and I'm glad to see so many attendees joining our conversation. So let me introduce our panelists for today. We have three. First, let me introduce Mate Kosier. Okay, woo, that's amazing. Mate is, and I hope you don't mind my using first names, is the director of the Institute for Research and Development, UTRIP, and it's in Slovenia, and I'm going to have Mate tell you more about it. Mate has a huge amount of experience across the board, has a doctorate in public health, and from Liverpool, and also is an economist at some level. So we'll be interested to hear how that kind of coincides with your work. So Mate, why don't I'm going to move on and introduce everyone, and then we'll move into the conversation. Jamie Malian is a lecturer in, and I hope I pronounced it correctly, is a lecturer in psychology at London South Bank University. Jamie completed her degree in psychology at University of Kent, and she then continued her studies at the University of Kent with an Economic and Social Research Council, which funded her MSc and PhD in forensic psychology. Jamie has undertaken multiple research internships and held research assistantships in both forensic and National Health Service settings. Jamie's research interests focus on group-based offending, particularly street gang membership, and has a particular interest in offender rehabilitation and intervention with a focus on strength-based approaches such as the Good Lives model. And I'm sure you'll say a little bit about the Good Lives model. Our third amazing presenter today is Daniel Semenza. And Daniel, you want to introduce yourself just briefly?
Yeah, sure. My name is Dan Semenza. I'm an assistant professor at Rutgers University Camden, so right across the bridge from Philadelphia. I'm in the Department of Anthropology, Sociology, and Criminal Justice, where I do research and teach courses on urban gun violence, health-related issues with the criminal justice system and juvenile delinquency, and other forms of violent crime. Today, I'll be talking about non-fatal gun violence and community health behaviors, specifically in Philadelphia.
Okay, great. Thank you. Thank you, the three of you, for joining this panel. So before further ado, let me introduce Mate Kosier, who will be our first panelist today. Thank you.
Okay, let's share my screen.
Thank you.
Do you see it correct?
Yes, we can see it. Thank you. And now I will mute.
Yeah, I will actually present you quite interesting initiative, which started as a minor issue, actually as a part of a bigger program. Our institute works in the field of prevention and advocacy. Mostly we try to establish some prevention quality standards in different settings in Slovenia. And alcohol policy is actually just one small part, was a quite small part of our work in previous years. But as you know, Slovenia is a beer producing and wine producing country. So alcohol is quite influential regarding prevention. And we found out quite early enough that we should work more on alcohol if we want to have some population level outcomes, positive outcomes regarding prevention. So actually we started to with some initiatives regarding mystery shopping activities with some youth non-governmental organizations in Slovenia, and started the project in one relatively small city of Kranj, which is on the northern part of Slovenia. So we actually established a project with one city, and you will see later on how far we actually are going with this small, short initiative. We actually established also a generic logic model from one evidence-based intervention, which is called STAT. STAT is intervention which was invented by City of Stockholm together with Karolinska Institute, University in Stockholm. And this is quite well known, especially in Europe, evidence-based intervention focused on community mobilization and also enforcement, etc. So it's quite extensive, complex intervention. And you can see in this generic logic model, we focused our intervention in nightlife settings. So we thought that this might be an interesting research topic to investigate a little bit more how big problem is, how alcohol is a big problem in our nightlife settings. But as we are at the Law Enforcement and Public Health Conference, I will focus a little bit more on this component which is related to enforcement of existing alcohol laws at the local level. We also decided not to expand too much regarding the target groups. So our focus were youngsters, age 15 to 18, and also young adults, which is 18 to 24. We know from our statistics that this, the second target group, is very relevant regarding drink and driving and also some other crime statistics in our country. So our focus were actually double. We try to figure out what is the compliance rate regarding alcohol sale in nightclubs and pubs and bars to minors and also to intoxicated people. And we didn't have this data in Slovenia at all. There were, of course, some mystery shopping activities in previous years, but mostly in supermarkets, petrol stations, etc., but not in the nightlife settings. So we wanted to investigate a little bit more how big this problem is in Slovenia regarding alcohol and nightlife settings. We knew something from research, of course, because there were some activities already implemented in the past, especially by youth organizations. And we also knew at that time that compliance rate in this particular city of Kranj, when we started this initiative, in supermarkets and gas stations, were compliance rate was about 4% only. So the youngsters, minors, were successful in 96% of cases, and they bought alcohol quite easily in supermarkets and gas stations in the city. But as I told you, this was quite innovative initiative because we didn't have any data on selling alcohol, first in nightlife settings and second to intoxicated young people in Slovenia. So baseline measurements, as you can see, compliance rate was 0. We divided nightclubs, bars and pubs into 3 different groups, with control group, of course, and we planned also to do some interventions in 2 different intervention groups. First intervention group only with some media activities, some communication with them, and also the third intervention, the second intervention group also with some enforcement activities. So that was the plan initially at the beginning. We also did a training of staff in nightlife venues. So we gathered them, 12 of them, which was quite good attendance. among the intervention venues. So we did 3 hours training, but not focus on alcohol, because in STAD model, in Swedish model, they focus pretty much only on alcohol. But in Slovenia, it wouldn't work really well, because we try to do some other strategies to convince them to come to the training with some topics which are used to be are probably more relevant for them than alcohol policy. So we actually invited them to speak about some communication, conflict solving, some preventive strategies, management of physical contacts, for example. First aid was quite interesting also session. So we try to bring them on board with some topics which seems to be more relevant to them as maybe alcohol. If we would invite them only focusing on alcohol, probably attendance rate would be much lower than with these kind of topics. So it was quite intense 3 hours, interactive work. They worked in groups as well, and discussed a lot among them. So it was quite intensive 3 hours. And then we did some also other phases of measurements, and we actually found out no change in control group, and also no change in intervention group, which we focused only on information giving and communication with them, etc. And as you can see, also the training is not mandatory, it was voluntary. So training didn't have any influence on results, on outcomes. But we saw some improvements in the group with some more enforcement, which means enforcement. I will explain a little bit more later what kind of enforcement it was, because we actually wanted first local police to be involved. And this is actually the biggest problem in this intervention. Because although we put a lot of efforts also to media advocacy, to explain not just at local level, but at the national level, it was quite good coverage. So people actually in the city and the nightclubs, night bars, knew about this campaign also from the national and local media. So we put a lot of efforts to send this information out to media. So most of them knew. What actually happened? I would say failure, complete failure. You saw the measurements. And this is because enforcement component didn't work well. And I will explain why. At the beginning, local police were very enthusiastic to collaborate in this project. But just a few weeks before the first intervention, they actually informed us that they see a lot of problems, a kind of ethical problems to be involved in, a kind of interference to implementation of the law, although it is from the positive perspective. So actually they pull out of the intervention. So we were quite alone. And we try to do some other enforcement measures with the local enforcement officers, not police, but we have in Slovenia some a kind of local security people. So we try to improvise a little bit and send those local guys from local authorities around and check, show themselves in the neighborhoods, etc. But this was, not just from the perspective of nightclubs, pubs, and bars, but also from the perspective of policy and decision makers. Because the city of Kranj, after they saw the results, they refused to organize press conference in their own city because they were afraid of, I don't know why, reaction from people. From local people. I have no idea why they actually resigned from the intervention. It was quite difficult to communicate at that time with them after they saw the results. So we tried in some other cities as well with some local partners. We set up some regional coalitions of non-governmental organizations, and it was pretty much the same problem. Police didn't want to be involved in these interventions because of, they said ethical reasons, etc. And of course, the result was the same, very bad results. Not more than 10% of compliance with the legislation. So we suspended actually the activities because we saw no use of it to repeating the failure again and again, and try to figure out what to do in the future. So we actually initiated collaboration and discussion with the police authorities in our country. And they actually realized that this is probably a very serious problem in Slovenia. So they opened their doors for us to discuss this issue. And maybe the idea was to change the mindset of police in Slovenia from repressive actions like waiting for drunk drivers at some part of the streets to be more present in the nightlife area during the weekends, during the nights, etc., to have a positive impact on outcomes at the end. So less problems with alcohol, less crime because of alcohol, less violence because of alcohol, and less road accidents because of alcohol. So we established quite well collaboration and discussion with police authorities at the national level. Then we also initiated an awareness media campaign and advocacy because we noticed that there is complete indifference regarding these problems in Slovenia. People promoted, that young people should try and drink alcohol to become adults and responsible, etc. So this is a part of growing up process. And of course, we didn't agree with this. So we initiated a media campaign, especially because of low budget on the Facebook. And the title of this campaign was "Because Alcohol is Not a Milk." You should not treat alcohol as a milk because it's a different commodity. It should be treated like something more dangerous than it used to be, not just in our country, but also in other countries. So, the problems in Slovenia because of alcohol is huge. So we wanted to present this as a problem. And also we put some provocative messages and questions for discussion in Facebook. And we got a lot of responses, positive, negative, more negative. So we knew immediately that this is something we should invest more time and more efforts and maybe prepare more strategic campaigns and maybe some advocacy campaigns to change legislation, etc. So this was quite kind of myth-busting campaign on the Facebook to discuss about some myths about alcohol. And the results were pretty good for small Slovenia. You can see the numbers. You will be able to see also the PowerPoint presentation. So I will skip these details. So what is happening now? So we actually decided to move forward to more complex and strategic activities. We established a coalition entity, which is Slovenian NCD Alliance, and we don't cover only alcohol. We try to cover also other non-communicable diseases. It was established last year, and the priority was we set alcohol as a priority in our near future. And we already filed a week ago a revision of alcohol-related legislation, a proposal to the Minister of Health, and we are starting now discussion about changing alcohol-related legislation in our country, including related to nightlife settings and youngsters, etc. So it's quite a complex proposal. And
I need to say that you only have a few minutes, so you might want to 2 minutes.
This is my last slide. So
sorry. Okay.
Thank you. And we also upgraded the relationship with the police. So we actually signed a contract with them to do some activities at the national and local level. So they actually decided to join our forces also at local level with our local mystery shopping activities to pilot this new approach, to be present during the activities. and also to offer some training and education to police officers regarding alcohol issues, because we really try to change the mindset of police in our country. So this is our long-term strategy, because otherwise we don't see any use of these mystery shopping activities if we don't improve this enforcement part of the STAT model approach in Slovenia. So this is actually one of the most interesting campaigns of our institute in the last couple of years, and we enjoy upgrading and go more strategic with more and more organizations in Slovenia. So hopefully, maybe in 10, 15 years, we will change situation in our country regarding alcohol and enforcement. Thank you very much.
Thank you very much, Mate. We're going to save questions till the end, and remember, put your comments and questions into the chat. We'll move on now to Jamie Malian. Jamie, it's great to have you. I'll just turn the mic over to you, and you can share.
Can you see my screen?
Yes, we can.
Okay, perfect. So I'm going to talk today about my PhD research, which focuses on the theoretical application of a new model of intervention to street gang members. So last year, the World Health Organization specified that youth violence was a global health problem requiring immediate attention. And we know that street gang membership is one of the leading causes of youth violence internationally. So to be able to reduce youth violence, we equally need to reduce street gang involvement. We also need to consider the long-term negative impacts of street gang membership. Even after the individual has left the gang, they are more likely to suffer from unemployment, difficulty establishing relationships. They're also more likely to perpetrate child abuse and intimate partner violence. But one of the first things we need to consider is how we actually define a gang. Now, we see that in academia, this often differs from law enforcement, and even across law enforcement, this would differ from area to area. Now, when I talk about a gang, I'm using this Eurogang definition. So this suggests that a gang is a group of 3 or more. It lasts longer than 3 months. They're primarily young, so under the age of 25. And they spend a lot of time on the streets, and they engage in and approve of illegal activities as a group. Now, most research has looked at the risk factors for street gang involvement. So this are things like difficulty securing relationships, emotional support, and so on. And they found that if there's street gang members experience more of these risk factors than any other offender group. So even youth violence, individuals involved in violence, they experience less of these risk factors than gang members. However, in areas that there's a high presence of street gangs, so people exposed to similar risk factors, 75% of young people still successfully avoid membership. So research needs to consider the protective factors. What stops somebody from engaging in a gang? Now, current interventions, although there has been some success, so for example, the GREAT program, which is run over in the States, has seen a reduction in street gang membership over a 4-year period. However, for the vast majority of street gang interventions, the evidence base is weak. And often this is because of poor retention rates. So street gang members drop out of interventions quite often. There's a lack of therapeutic alliance, and we know that's one of the key ways of a successful intervention. Street gang interventions are also overly focused on risk. So if you think of a pincushion, it's about removing all of these risk-based pins, but the interventions don't fill those holes. So that's one of the issues, one of the major issues. And again, street gang interventions fail to target the benefits of belonging to a gang. And that's what my research focuses on, is this benefits of a gang. So I use a model called the Good Lives model. It's an offender rehabilitation model that's been used for a number of offending typologies successfully, but has not previously been used for gangs. And this model is a strengths-based approach. So it looks at the strengths and the good parts of the individual and builds on these to help them avoid engaging in offending. So it suggests that in order to have a happy, healthy life, we have to secure all of these 11 primary goods. And that's inherently normal behavior. So we've got things here like inner peace, which is being free from stress and emotional turmoil. We've got agency, so feeling independent, having a sense of autonomy. Now, the problem is weaknesses either in the individual or in their environment can prevent people from securing these in pro-social ways. So it might be then that they turn to antisocial behaviors such as gang membership in order to secure these. And this is what my research focuses on. It's exploring whether street gang members are trying to achieve these primary goods through their gang membership. And also what factors are leading to this, what weaknesses in the individual or the environment cause this. So I interviewed 17 incarcerated street gang members that are classified according to that Eurogang criteria. And I asked them, around the time of their gang membership, how important were each of those primary goods? How did they go about achieving those primary goods? And also what prevented them from achieving it? And we got some rather interesting findings. So for example, the primary good of life, which is having survival instincts, really, protection, somewhere to live, that kind of thing. The street gang members discussed financial gain, which allowed them to pay for their rent and their food and so on, which was provided by the street gang. They also had a sense of protection by the gang. With regards to inner peace, the street gang members often found that being in the gang helped them to cope with bullying. So the majority of my street gang members were bully victims. So by being in the gang, it stopped them from being targeted. It also allowed them to express negative emotions. So many of them had this anger all pent up and they wanted to get rid of it. And a gang membership allowed that. A lot of them had also experienced trauma, and substances helped them to deal with this. So they could access these easier by being in a gang. Now, with regards to agency, so this is the sense of independence, they felt free from authority by being in a gang. They could go up against the police and so on. They had a sense of power and control, and also they gained this status by being in a gang. Interestingly as well, the street gang members said that they often took on leadership roles, which, because of different things such as a failure to achieve academically, would not have been available to them outside of the gang. Now, regarding play, a lot of the gang members discussed that around their teenage years, they lost their recreational activities. They didn't find anything fun. And the gang replaced this. It was a deviant leisure activity in and of itself. Now, pleasure, this was a really interesting finding. Many of the street gang members actually became addicted to the street. So they wanted to be there all the time. And they often got these withdrawal symptoms when they stepped back from the street when they went home. Again, financial gain and substances was suggested as a pleasure experience. And they also found it easier to access sexual relationships when in the gang compared to before when they were not in the gang. Now, with regards to excellence in work, the gang was seen as a criminal career and of itself, often because they struggled to secure work outside of the gang. They also were able to engage in this deviant entrepreneurship, so their business skills grew by being in the gang. Now, knowledge, similar to what I was saying with the lack of educational attainment, they struggled to secure a sense of knowledge outside of the gang. But in the gang, they learned how to offend. So they were learning skills, which obviously are antisocial, but it allowed them to achieve this. And also they passed this information on to younger members. So they were teaching others. Now, with regards to creativity, the gang was a place where they could engage in deviant creativity. So it was supportive of things like graffiti. I mean, some of the gang spoke to me about how they dyed different drugs at Christmas, so red and green, to make them look festive. So obviously that's a form of creativity. And again, some of the participants thought that they had to be in a gang in order to engage in certain creative activities, including rap and drill music. They felt the only way to secure that was by being in a gang. Now, with regards to spirituality, this means having a sense of meaning and purpose in life. And by having these group-based goals that they could work towards and achieve, they got this sense of meaning and purpose. And also within the gang, they were perceived as successful, which they wouldn't have been found outside. Now, relatedness was one of the biggest things that drew people to a gang. They got the emotional and social support that they didn't get elsewhere from family members. And they were also able to develop very close friendships. And the last primary good is community. So they got a sense of belonging by being in a gang. And they also provided for their community. So they did things like held barbecues for the community, and they protected their area too. So it gave them a sense of importance, really. So just to summarize those bits, all of the primary goods were important to street gang members. So this supports the theoretical application of this model to street gang members. Now, gang membership represented a means, so a way of going about achieving these primary goods, albeit an antisocial way. There were numerous obstacles experienced by street gang members. So this included access to education, problems with work, employment, problems with family, and so on, that prevented them from achieving these primary goods through pro-social means and led to these engagement in antisocial means. So what does this mean going forward? Well, the Good Lives model, the intervention, suggests that to have a happy, meaningful life, you need to have something that works for the individual. So they have to achieve these primary goods that they want to achieve. But it also has to be done in a pro-social way. So a Good Lives model is about identifying the strengths of the individual, building on those, and helping them to achieve these goods through a pro-social way. Now, that does mean that there needs to be a multidisciplinary approach, so incorporating police, social work, health services, and so on. The Good Lives model has been successfully used with previous offending populations, as I said. Compared to other forms of intervention, so these risk-based interventions, treatment completion was higher, and they also developed good therapeutic alliance because of this strength-based approach. The clients were more motivated to take part, which led to less dropouts, obviously. And there was also improvements in the problem-solving and coping skills abilities before and after. Now, interestingly, when we think about street gang members, this one of the prominent findings was the social support systems that offenders had in place by the end of the interventions was better in Good Lives-based interventions than in risk-based interventions. So going forward, we're looking to actually apply this model to street gang members in practice. Thank you.
Thank you very much, Jamie. Appreciate your presentation very much. All right, Daniel, thank you for joining as well, and we're looking forward to hearing from you.
Okay, great. Let's see. Let me share my screen. Okay, can you see the PowerPoint? All good? Everyone can see?
Yes.
Okay, excellent. So my name is Dan Samantha. I'm an assistant professor at Rutgers University at Camden. So for those of you not from the area or familiar, Camden is right across the bridge from Philadelphia. So very, very close to where the conference would have taken place in normal times. And my project is also very much focused on and centered around issues in Philadelphia. It has a broader scope moving forward, but today I'll be talking about Philadelphia in particular. And just as a heads up, a shout out to my colleague, Richard Stansfield, who is also a major part of this work. The project is about non-fatal gun violence and community health behaviors, focusing on neighborhoods in Philly. So just to start off, for those that may or may not be familiar, Philadelphia in 2020, along with a number of other cities, had a record year in terms of shootings and homicides. So this is as of December 28th. There were 493 homicides in Philadelphia, a major percentage up in homicide victims. I believe this crossed the 500-person threshold by the end of the year. And this is a story that now that kind of data is being crunched and analyzed over the last 3 months, this story is coming out again and again and again for a lot of major cities in the United States. So Philadelphia is worse than average, but certainly not fully unique in terms of the major uptick that we saw in homicides over 2020 during the pandemic. The thing, though, that I'm focusing on today is the fact that for every homicide in the United States, and this is regardless of the uptick or not in 2020, there are 4 non-fatal firearm injuries for every homicide. So you have this ratio where 1 person is killed and 4 other people are shot and they are injured. And for much of the research that has been focused on gun violence, that has been feasible for the data that is available, it necessarily focuses on homicide. Homicide data is the best data available. It's collected in a standard way. It's reliable in that we can be pretty sure that the homicide data that we're using is pretty good. But the problem is that non-fatal gun violence has been pretty understudied because of this reliance on homicide data. And so what my colleague and I and many other people are doing in public health and criminal justice are starting to really do is try to find ways to look at firearm injuries, to look at shootings, not just in terms of homicide, but look at kind of the consequences and fallout of what happened after the shootings when a person remains alive. Now, there has been some research that looks at the health impacts of community violence. I remember when I was in grad school and I first heard the term gun violence as a public health problem, I took it really, really literally because I was thinking not just about the violence that occurs from gun violence, but also the health impacts that come after a person is shot, how it affects community members, how it affects family members, things like that, the kind of ripple effect. So there's been some research that looks at kind of more broad general exposure to violence in neighborhoods. And this is pretty definitive in that exposure to violence in the neighborhoods is harmful to mental and physical health. It's harmful to health behaviors, which I'm going to focus on today, such as reducing physical activity, inadequate sleep, smoking behavior, poor diet. And some of it has to do with mobility, right? If you feel like you live in a dangerous environment where there are a lot of shootings, you aren't going to go outside, you're not going to walk as much. You may quick go to the corner store, but not all the way to the grocery store, so your diet may suffer. There are a lot of different kind of ramifications here. And the typical explanation for this, based off of the research that's been done, is that this kind of exposure to violence has an effect either on the individual or vicariously through witnessing that increases chronic stress and degrades collective health. Much of the research in this area has been done using surveys, asking people what their perceptions are of the neighborhood, what their witnessed or vicarious violence exposure might be. But it's typically focused on individuals. It's not looking at the community as a whole. And so there has been this reliance on this kind of stress model, which I think is really good, but there is something missing here. And again, what's missing is this lack of attention on non-fatal shootings and different or alternative pathways to think through how gun violence might be a more literal public health problem when we think about survivorship. And so there are more than 85,000 shootings every year in the United States. This number always, I have to like double read the number every time because it's just, the magnitude is so large. But on average, you have a tremendous amount of shootings. And again, you know, the majority of those people that are shot live another day and they survive. And so, of course, when we think about poorer health and what the ramifications are for gun violence, there can be this indirect community exposure, this kind of stress response, or intentional behavior changes because people perceive the neighborhood or the community as violent and therefore unsafe. But my research here and in the broader project that this is a part of is focusing on the question of what happens when you have communities that are filled with gun violence survivors or have many more gun violence survivors than maybe more advantaged communities. And this is built off of a lot of really good qualitative research by Jiyong Lee, John Rich, and Desmond Patton and a number of others that talk about what it's like to survive a shooting. The disability, the lack of physical activity, the effect that it has on sleep and substance use. And so the question that really drove this study was to look at what if you look at non-fatal gun violence and you have people in the community that are surviving, how does this affect community health more broadly overall? And I have this quote from Ji Young's paper in 2012, where he says, gunshot victims live with bodily injuries that make sleeping, eating, going to the bathroom, working, having sex, and conducting other previously taken for granted aspects of daily living difficult. So this is thinking about that survivorship and what it does to broader community health. So the study that we conducted, again, this is part of a broader study that's now rolling out into a more national approach. But this one was first focused on Philadelphia. It's under review now, and it looks at all 376 residential census tracts in Philadelphia from 2015 to 2017. It's a cross-sectional analysis. We were able to get shooting data, both fatal and non-fatal data from the Philadelphia Police Department. This is crucial because a lot of cities, in fact, most cities don't make this publicly available or make it very difficult to get, even if you're trying to work one-on-one with the police department. So this is a major benefit to using Philadelphia. And then we used this data with a data set from the CDC Places Project, which is a tremendous tract level health data set for all census tracts in the 500 largest cities, I think it is, in the United States. It's relatively recent. There's only 5 years of data available, but we were able to pair these things together along with demographic data from the American Community Survey to look at census tracts in Philadelphia and look at these dynamics. And so we have shooting and the health behavior outcomes. We constructed an index that looks at smoking, sleep, lack of physical activity, and clinical obesity. These things kind of tie together in what you could think of as a health lifestyle, right? How does shootings in a community influence the community's health lifestyle overall on average in different neighborhoods? And we control for, I'll show you, but a number of different things in terms of the composition of the local neighborhood, the percentage of people who have health insurance, age composition, percentage of people living in substandard housing, a lot of things to get at kind of what the community is like for each neighborhood. So these are just some quick descriptives. I'm not going to bore you and read through all the different means and standard deviations, but I am going to put you to look at one thing here. It was where you can look at the total shooting rate and then broken down by fatal and non-fatal. And as you can see, you have roughly that same ratio that I was talking about, where if you were to only look at homicides or only think about homicides, the magnitude of the gun violence problem of the shootings would look much smaller than when you look at the non-fatal shooting rate, which is much, much, much higher, and really the focus of what we're looking at here. And then if you look at that health behavior index, you can see that you have relatively, these are all binary variables, you have relatively high proportions of people who are engaging in pretty unhealthy behaviors overall. And so here are the results. Again, I'm going to draw your eye just toward the shooting results, just so you can see kind of the major effect that we're talking about. Now, based on the qualitative data that is in prior research, we were under the hypothesis was that, okay, when you look at shootings in total, you're going to see an effect based off of the exposure and maybe the stress kind of model or mechanism that others have theorized when it comes to behavioral health. But when you break that down into fatal and non-fatal shootings, what you actually get is that the non-fatal shootings are what are driving the increase in poor health behaviors, right? So you have a positive relationship where the higher the rate of non-fatal shootings in a neighborhood increases that risk of poor health behaviors, again, at the community level, not at the individual level. And this is controlling for all the other different compositional elements or, you know, the makeup of those neighborhoods, so to speak. And so,
Daniel,
yes.
less than 4 minutes.
You got it, no problem. So when we decompose the fatal and the non-fatal shootings, you get this more stark picture of the fact that the fatal shootings are not necessarily what's drawing that, but the non-fatal shootings are. Now that gives us some initial indication that this might be less of a generalized exposure issue and more of a survivorship issue, where you have more people in the community who are dealing with the fallout or the ramifications of surviving an attack, and that is influencing their behavioral health, rather than people who are responding and saying that they've been exposed or that they're aware of living in a more dangerous neighborhood, and that's in fact what's driving. But of course, we don't know 100% for sure. This is just an initial indication, and we're starting to tease some of this out more. But in terms of kind of summarizing and taking the results together, what we are seeing is there is the initial indication that non-fatal gun violence specifically is consequential for this kind of range of health behaviors. And when you look further into the analysis, which I didn't show here, there's a particular impact on non-fatal gun violence on obesity and physical activity. So again, if you think about being shot, being disabled or debilitated, not being able to walk, not being able to exercise, or being afraid to do so because you're hypervigilant because you've been in this really terrifying situation. So that's where we see kind of some of the driving elements of the poorer health behaviors when we talk about non-fatal shootings. And what we think that this is showing, or what we think that this is a first step into looking into, is that the health effects of violence go beyond individuals for sure, and there are harms here for entire communities. And what I really want to point out here is that when we talk about these high shooting rate neighborhoods, we are talking predominantly about neighborhoods that are disadvantaged and composed predominantly of African American residents. So this has implications here for health and or racial health disparities as well, right? Because there is the higher exposure of non-fatal shooting, that is where you are really seeing these health impact, and that's affecting communities of color in an outsized way. So these non-fatal incidents can fuel cycles of violence and retaliation, which are much more prevalent, than homicide. And so you can have this kind of enduring effect because the non-fatal incidents are so much more prevalent in these neighborhoods. And just some implications of future research really quick, because I know I just have a minute or two. I will probably say this in every presentation I give for the next 30 years, there has to be better data on non-fatal shootings. We just don't collect it, we just don't have it. And I'm sorry, is that it?
You finish your thought and then, they're gonna cut us off. Okay.
Okay, sure. Yeah, so we need better non-fatal data collection, thinking more about this literally as a public health issue. And then you have some future research, which I'm happy to talk about more, that we're kind of continuing as we go now. So thank you very much.
Thank you. So we've had the pleasure of listening to three very interesting projects that have transpired over the course of the last few years. And what I'm hoping is, because they're going to cut us off apparently, that you all can begin the process of exchange. There are no other comments in the chat at this point. I'm sure Daniel, Jamie, and Mate would enjoy hearing from everyone. And I know that in the conference information, you will be able to obtain their emails. So please be in touch. My apologies. I thought it was important that you get to share the information and the work that you've been doing. And I'm sure that we will all connect in multiple ways. So thank you. And I wish you a pleasant day. Take care.
Thank you.
Thank you very much.
Thank you. Bye.
Bye-bye. Bye.
Bye.
Thank you.